Hi guys, it's Eric Beard. I just finished an awesome Saturday morning workout. I don't always get to go to the gym on Saturdays, but I got to it today. And it's something I've seen a lot more lately in gyms, and I'm very happy to be seeing it. It's used as the foam roll for some self-myofascial release or self-massage work. And it's wonderful to see, especially over the last 10 years, it's really grown in popularity. But I gotta tell you, there's something I see that's driving me absolutely berserk, and it's people using the roller incorrectly. They're going way too fast. They're going 1,000 miles an hour, like they're trying to start a fire in between their leg and the foam roll. You know, you're not a Boy Scout out in the woods stranded to get your badge. You have to take two sticks together and rescue yourself by combusting a pile of straw. We're using the roller to get responses from specific receptors within the tissue. And we're not going to get that by going back and forth quickly. And I've seen this on instructional DVDs, I've seen it come from professionals, and I see a lot of end users doing this as well. Is people will be on the roll, and they'll be going like it's some sort of vigorous workout. There are a few ways to approach this, and I'm going to cover just two of them, and there's probably a lot more. But you can do a slow, steady roll. The slow, steady roll is going to work on some of the deeper receptors within the tissue. This is almost going to be similar to effleurage. Massaging effleurage stroke is a little bit more superficial, but it's a deeper compressive stroke than effleurage. Moving through the tissue, what it's going to do is it's going to move blood and lymph, but there are deeper receptors that will respond to this, and that will release by doing that slow, steady roll. But by going slowly, you get deeper into the tissue. Just think if you were sitting or standing in some water up to here, and you take your hand and splash your hand into the water and try to push it down. The water would go up in the air and it would be slow progress towards the ground. If you were to take your hand and gently set it into water and let the hand sink, it would open up. So the slower that you move with the roller, the more these tissues open up, the less resistant that these mechanoreceptors, especially the muscle spindle fiber, will be. If we're going quickly and aggressively, the spindle fiber is going to keep that contraction in the tissue. It's not going to want to let go. So whether you go with that slow, steady roll, the more traditional approach that we see in health clubs is find a spot, slow, steady roll, stop on it, stay on it, hold it, wait for that autogenic inhibition, that neurophysiological principle where you're holding 20 to 30 seconds. It's probably longer. Research says 20 to 30, probably closer to a minute for someone who's deconditioned or unfamiliar with this technique. Wait for that discomfort to disappear or decrease by about 75% and keep rolling. We want to get about 2 releases per muscle, and then the slow, steady roll before that can work, number one, to work with deeper receptors. Number two, it can work as a search and destroy mission, let you go through the tissue, find which tissues are most aggravated, are most tonic, are most ropey. And you can also use that rolling technique, number three, at the end to potentially realign any of those inelastic collagen fibers that we perhaps have released by holding that spot. So 2 typical approaches here that I'm addressing: slow, steady roll, then stop and stay, more of a trigger point therapy. I don't really like the word self-myofascial release. Self-myofascial release in massage therapy has a different connotation, but it's been adapted in the health and fitness industry. It's more of a trigger point therapy or sustained direct pressure or myopractic technique. We find a tender area or a point of restriction or tissue density, add pressure, wait for autogenic inhibition, then move to the next area. You can use that and then finish with the slow, steady roll as well. So use a roller, use a ball, use something expensive, use something homemade. Don't care about that. But sink into the tissue. The tissue will be resistant if you just keep stabbing it or jabbing it. Just think if you walk up to someone and you kind of jab them in the ribs or you try to poke them, the response is going to be contraction, almost like they're getting tickled. You're doing the same thing with the roller. But if you put your hand slowly on someone's shoulder, they'll relax and the tissue will let go. Let's do the same thing. Make friends with your roller. Don't stab yourself with it. Thanks for watching. I'm Eric Beard. Have an awesome Saturday.